Look at your fingernails for a moment. Press down firmly on one nail for about 2 seconds, then release it. Watch how quickly the normal pink color returns. That simple check is called a capillary refill test. Doctors sometimes use it as one small clue when assessing circulation. It cannot diagnose heart disease by itself, but when it is considered alongside other changes in your nails, hands, and overall health, it may tell you that your body deserves closer attention. This matters especially after 60. Cardiovascular problems do not always begin with crushing chest pain or sudden collapse. They can develop quietly while the body compensates for months or even years. Your nails grow from living tissue supplied by tiny blood vessels. Because those vessels sit close to the surface, changes in blood flow or oxygen delivery can occasionally become visible there. Today, we will examine 4 nail signs that may appear alongside circulation problems, heart or lung conditions, anemia, and other health concerns. The 4th sign is one most people rarely inspect, even though it takes only seconds to check. Before we begin, remember that nail changes are common and often harmless. Aging, cold temperatures, dehydration, injury, fungal infections, skin conditions, nutritional deficiencies, frequent hand washing, and medication can all affect them. No nail sign can prove that you have heart disease or predict a heart attack or stroke. These are reasons to pay attention and speak with a qualified medical professional, not reasons to panic or diagnose yourself. If you're over 60, tell me your age in the comments and whether heart attack or stroke runs in your family. Family history is an important part of your overall risk picture. Each nail begins in a structure beneath the skin called the nail matrix, where new nail cells are produced. Beneath the nail plate is the nail bed, which contains many tiny blood vessels and gives a healthy nail its pink appearance. Nails are only one piece of a much larger puzzle. Your symptoms, medical history, blood pressure, cholesterol, blood sugar, medications, physical examination, and appropriate tests matter far more than appearance alone. With that in mind, let us begin. Number 1, a persistent blue or purple color. Examine the skin beneath your nails in bright natural light. Does it look normally pink, or does it appear blue, gray, or purple? A bluish discoloration is sometimes called cyanosis. It may occur when tissues are not receiving enough oxygen or when blood flow through an area has slowed. However, there is an important difference between color changes limited to the hands and changes involving the lips or tongue. If your fingers look blue after exposure to cold and return to normal after warming, temperature may be the cause. Some people also experience temporary color changes because the small vessels in their fingers constrict strongly in response to cold or stress. Persistent discoloration is different. If your nail beds repeatedly remain blue or purple despite being warm, it deserves medical attention, especially when accompanied by shortness of breath, unusual fatigue, swollen legs, dizziness, chest discomfort, or reduced ability to exercise. Color limited mainly to the fingers or toes may reflect reduced peripheral circulation. Blue coloring involving the lips, tongue, or inside of the mouth can be more serious because it may signal low oxygen. Throughout the body, if blue lips or tongue appear suddenly, particularly with breathing difficulty, confusion, chest pain, faintness, or severe weakness, seek emergency medical help immediately. Consider Frank, a fictional example. This retired postal worker noticed a purplish tone near the base of his nails for several months. It was most obvious in the morning, and after he had been sitting for a long time. He assumed it was simply part of aging because his hands had always felt cold. During a family visit, his daughter noticed the color and asked whether he had also been more tired. Frank admitted that climbing stairs had become harder and that his ankles sometimes swelled by evening. At his next appointment, he described the complete pattern rather than mentioning only that's his nails. That prompted his doctor to examine his heart and lungs and order appropriate tests. The lesson is not that purple nails automatically mean heart failure. They do not. The lesson is that a persistent color change becomes more meaningful when it appears with other symptoms. Check your nails near a window during the day. Remove nail polish if possible. Warm your hands, wait a few minutes, and look again. If the unusual color remains or repeatedly returns, photograph it and discuss it with your doctor. Number 2, nails that have become unusually brittle or slow growing. Nails often become drier and more fragile with age. What deserves attention is a noticeable change from your personal baseline, especially nails that suddenly split, peel in layers, break repeatedly, or seem to grow much more slowly than before. Many non-cardiovascular problems can cause brittle nails. Frequent exposure to water or cleaning products is common. Thyroid disorders, iron deficiency, skin disease, fungal infection, poor nutrition, and certain medicines may also contribute. Reduced circulation is another possibility. When blood flow to the extremities is limited, tissues may receive less oxygen and fewer nutrients. One condition doctors consider is peripheral artery disease, or PAD. It develops when arteries supplying the limbs become narrowed, usually because of plaque buildup. PAD matters because plaque rarely respects a single location. Someone with significant narrowing in the leg arteries may also have disease in arteries serving the heart or brain. That is why PAD is associated with a higher risk of heart attack and stroke. The nails alone cannot reveal PAD, the pattern around them is what matters. Ask yourself 3 questions. Have my nails changed noticeably? Are my hands or feet often cold or slow to warm? Do I develop aching, cramping, heaviness, or fatigue in my calves, thighs, or hips while walking that improves after I stop and rest? That exercise-related discomfort is called claudication. It is a classic symptom of reduced blood flow in the legs, although not everyone with PAD experiences it. Imagine Eleanor, a fictional 6-8-year-old gardener. Her nails began splitting, but she blamed years of working in soil and the dry winter air. She tried moisturizers, supplements, and strengthening polish without improvement. Months later, she casually mentioned that walking uphill made her calves ache. The discomfort predictably stopped after a few minutes of rest. Her doctor checked the pulses in her feet and arranged an ankle brachial index, or ABI. This simple, non-invasive test compares blood pressure at the ankle with blood pressure in the arm and can help identify reduced blood flow. Eleanor's nails did not diagnose her condition. They formed one part of a pattern that justified further evaluation. If your nails have recently become much more brittle or slow growing, look for accompanying signs: cold feet, numbness, shiny skin on the legs, wounds that heal slowly, reduced hair growth on the lower legs, or pain brought on by walking. Mention the entire pattern to your doctor and ask whether your circulation should be assessed. Do not begin high-dose supplements simply because your nails are brittle. Too much of certain nutrients can cause harm or interfere with medication. Identifying the actual cause is safer than guessing. Number 3, consistently delayed capillary refill. Let us perform the test carefully. Make sure you are in a comfortably warm room because cold hands can slow the result. Hold one hand roughly at heart level. Press firmly on a fingernail until the nail bed turns pale. Keep pressing for about 2 seconds, then release and watch the color return. Repeat th. E-test on 2 or 3 fingers. Do not rely on a single attempt. In many healthy adults, normal color returns within about 2 seconds. A slower result can have several causes, including cold temperature, dehydration, low blood pressure, medication effects, reduced circulation, or acute illness. The test is useful only as part of an overall assessment. It cannot diagnose atrial fibrillation, heart failure, or stroke risk at home. That distinction is crucial. A delayed result is a clue, not a conclusion. You can also compare the temperature of your hands with your face or upper arm. If your hands are persistently much colder in a warm environment, note it. Some people naturally have cold hands, and medicines such as certain beta blockers can contribute. Suppose Walter, a fictional retired teacher, repeats the test in a warm room and notices that color consistently takes 4 or 5 seconds to return. He also realizes that he has recently felt lightheaded when standing and unusually winded on short walks. Instead of assuming he has a specific disease, He calls his medical office and reports all three observations. His clinician can then decide whether he needs a blood pressure check, oxygen measurement, electrocardiogram, blood tests, or another evaluation. That is the proper role of a home observation. It helps you describe what is happening so a professional can investigate it safely. If your refill seems slow, warm your hands and repeat the test later. If it remains clearly delayed across several fingers, especially with faintness, breathlessness, chest discomfort, an irregular heartbeat, confusion, or severe weakness, contact a healthcare professional promptly. Call emergency services for sudden chest pressure, severe breathing difficulty, fainting, new one-sided weakness, facial drooping, or trouble speaking. Never use a nail test to decide whether those symptoms are serious. Before we move to number 4, tell me in the comments what you noticed. Did the color return quickly or did it seem delayed? Remember, this is an observation, not a diagnosis. Number 4, changes in the lunula, the pale half moon at the base of the nail. Look closely at your thumbnail. Just above the cuticle, you may see a small white crescent. That is the lunula, the visible portion of the nail matrix. It is usually easiest to see on the thumbs. It may be smaller on the index and middle fingers, difficult to see on the ring fingers, and completely hidden on the little fingers. That variation is often normal. Some healthy people naturally have prominent lunulae, while others have very small ones. What matters more is a clear change from what is normal for you. Have the half moons become much smaller? Have they changed color? Is the surrounding nail unusually pale, blue, or red? Has the change appeared together with fatigue, weakness, shortness of breath, dizziness, swelling, or another symptom? Changes in the lunula are not specific enough to diagnose heart disease. Their visibility can be influenced by normal anatomy, lighting, cuticle growth, trauma, anemia, systemic illness, and other factors. Online claims often exaggerate what lunulae can reveal, so interpret this sign cautiously. A very pale nail bed may sometimes occur with anemia. Anemia means the blood does not carry oxygen as effectively as it should, often because hemoglobin is low. The heart may then work harder to deliver oxygen throughout the body, but pale nails alone cannot confirm anemia. A blood test is required. Blue coloring around the lunula should be interpreted like any blue nail bed color. It may relate to cold or peripheral circulation, but persistent blue coloring, especially with blue lips or breathing difficulty, needs urgent assessment. Redness also has many possible explanations and should never be labeled as heart failure from appearance alone. Imagine Dorothy, a fictional 2-year-old grandmother. She notices that the crescents on her thumbnails are kark, dirt to see, and that her nails look generally washed out. On its own, that might mean very little, but Dorothy has also become exhausted after ordinary household tasks and sometimes feels dizzy when she stands. Her daughter encourages her to mention everything during an appointment. A clinician examines her and orders a complete blood count, which reveals anemia. Further investigation is then needed to identify why it developed, because in an older adult, the underlying cause matters as much as the low blood count itself. The nail change did not identify the diagnosis. It helped Dorothy recognize that several subtle changes were occurring together. Look at your thumbs and index fingers under consistent natural light. If you notice a persistent change from your usual appearance, take a clear, dated photograph and discuss it with your doctor, particularly if you also have fatigue, breathlessness, dizziness, palpitations, swelling, or reduced exercise tolerance. Now let us turn these 4 signs into a sensible plan. First, establish your baseline. Once a month, look at both hands in natural light. Check the color of the nail beds, the strength and growth of the nails, capillary refill, and the appearance of the lunulae. Monthly is enough. Checking repeatedly throughout the day can create anxiety without adding useful information. Second, document meaningful changes. Take photographs in similar lighting and write down when you first noticed the problem. Record related symptoms such as cold hands, leg pain while walking, breathlessness, dizziness, swelling, or unusual fatigue. Note whether the change affects one finger, or many. Third, consider simple explanations. Ask whether your hands were cold, whether you recently injured a finger, changed nail products, increased exposure to cleaning chemicals, or started a new medicine. Do not dismiss a persistent change, but do not jump immediately to the worst conclusion. Fourth, discuss patterns with your doctor. A single brittle nail after an injury is very different from widespread nail changes combined with exertional leg pain. A brief blue tint in freezing weather is different from blue lips and shortness of breath. Context determines urgency. Fifth, know the emergency signs. Seek immediate help for sudden chest pain or pressure, serious difficulty breathing, blue lips or tongue, fainting, confusion, new weakness or numbness on one side, facial drooping, or difficulty speaking. Those symptoms require urgent care regardless of what your nails look like. Most importantly, do not let normal-looking nails give you false reassurance. People can have significant heart or vascular disease without any visible nail changes. Continue routine medical care and recommended screening. Work with your healthcare team to manage blood pressure, cholesterol, diabetes, smoking, physical activity, sleep, and medication. Those factors are far more reliable for evaluating cardiovascular risk. Your body often communicates through small changes. The goal is not to become frightened by every line, ridge, or color variation. The goal is to understand your normal baseline and recognize persistent changes and know when a conversation with a medical professional is appropriate. After 60, early attention still matters enormously. Heart and vascular conditions can often be treated or managed more effectively when identified before a crisis. A thoughtful observation today may lead to a useful question at your next appointment. So, look at your hands once more. Are your nail beds their usual color? Have your nails changed noticeably? Does the color return promptly after gentle pressure? Do the half moons at the base look normal for you? Write down anything genuinely different, but do not diagnose yourself. Bring the observation and any related symptoms to someone who can assess the complete picture. If this video helped you understand your body more clearly, subscribe for more practical health information for adults over 60. Share it with a friend, spouse, or family member who may benefit from learning these signs. Remember, your nails can offer clues, but proper medical care provides the answers. I will see you in the next video.